Today we are going to talk about urethritis, a sexually transmitted infection that is caused by gonorrhea or chlamydia. There are two types of urethritis, one being gonococcal urethritis, which is caused by gonorrhea bacteria, the second being non-gonococcal urethritis, often caused by anything other than gonorrhea, often caused by chlamydia. 20% are gonococcal cases, and the other 80% are non-gonococcal cases. In most cases, men tend to have gonococcal urethritis due to sexually transmitted disease. Both of these infections can be passed through sexual intercourse, even oral. This STI is important to know due to the fact that symptoms are hard to detect, when at times this infection does not come from sexual interactions. This STI can actually come from irritations due from products used in the genital area, or even damage to the urethra by sex or by objects that are inserted, such as a catheter. This STI can also come from bacteria in the throat, mouth, or rectum. This bacteria can actually get into the urethra, which is the tube that carries urine from the bladder to the outside of the body. When the urethra becomes infected, it becomes inflamed and irritated, and even outside of the urethra, you can see redness around. When it becomes painful in the inside, there's also a burning sensation when you feel like urinating, or even during sexual intercourse, there's more of an urge to urinate more often. With gonococcal urethritis, often a yellow discharge from the penis or vagina may occur. Men experience pain in the testicles, and women experience pain in the lower belly. Less common symptoms in men is blood in the urine and blood in the semen. They also feel itchy and it's painful, and the penis is swollen at times. For women, peeing only small amounts every so often is also a symptom, and cloudy to foul smelling urine. If you have a lot of pelvic pain, that is also a sign for urethritis. Your doctor will diagnose your urethra for any abnormal discharge and for any other signs of infections. At times, they can obtain fluid using a swab to test, and urine tests can also be performed to make the diagnosis more reliable. If urethritis is detected early, there is a possible way to treat it with antibiotics. Your doctor will prescribe the correct antibiotic, and if you continue treatment as your doctor directed, it can go away in about 3 months, and if not, the infection can become worse. Another way to help with the pain is to drink lots of water. A publication by American Family Physician recommends that people with urethritis should drink plenty of water during and after treatment. It helps flush the bacteria out of the urethra. It is recommended, if you have urethritis, to get tested for other STDs to prevent the spread, because this STI is linked to gonorrhea and chlamydia. Your doctor might prescribe you with two types of antibiotics in order to get rid of the disease. But it is hard to detect. These aren't all the cases that have been reported. Women do have a higher risk of getting this infection due to the fact that the urethra is such a smaller space that it is easier to catch the infection. Urethritis occurs in 4 million Americans each year. Worldwide, approximately 62 million cases of gonococcal urethritis and 89 million new cases of non-gonococcal urethritis. Men between the age of 20 to 35 years are most at risk for developing infectious urethritis. Therefore, if you are going to engage in any sexual activity or share anything with friends or partners, be careful and always get tested.